Hi, I'm Karim Baroudi, Hancock Public Health Commissioner, and welcome to our Thursday update on the COVID-19 response in Hancock County. I'm going to start by giving you a quick summary of our situation as it stands right now. We do have 25 confirmed cases of COVID-19, 6 probable cases for a total of 31, and we have 7 hospitalized. Now I want to say one more word about hospitalization and how do we keep track of that number, because we've been getting a lot of questions from people about why you don't report on people who are leaving the hospital. The answer is quite simple. From a public health standpoint, we want to make sure we keep track of all the people who were hospitalized because of the infection, so we can gauge how bad the infection was in Hancock County and how we responded to it. Now, with that said, people will get better as they are hospitalized and will leave the hospital. It's unfortunate we had one death that happened to an individual who was hospitalized. So if we say we have 7 hospitalized, 5 of them currently were discharged, and only 2 people are still in the hospital. We're gonna try as accurately as possible to kind of convey a picture to the public about the infection and how it's spreading, and how severe it is in our population. That's why we report our numbers the way we do. Now, with that said, numbers are numbers. I don't want you to kind of get hung up on numbers too much because of 2 things. First, we're not testing enough people because of the shortage in testing. We're only testing the people who are sick and need to be hospitalized and have symptoms. Second tier for testing is the healthcare workers who takes care of those individuals. Those are our 2 priorities right now. Now, as we are prepping with the state and the federal government to reopen the economy, in phases, we are hoping that we can ramp up testing and test a lot more people who are going back into the workplace. This will give us a better indicator of how bad the infections and how bad the spread of this virus is in our community. We're going to keep up on hand washing, double down on hand washing, wear masks when we're in public, coughing in our sleeves, social distancing. All those things are going to be really important as we are prepared to open back our city and our county. We can't stress that enough. We cannot go back to start opening, essential businesses and in phases going all the way up to go back to normal, hopefully. But we need to keep those with us for a long time. Hand washing, wear a mask, social distance. Those are 3 important things to remember. If you're sick, stay at home. Now I want to talk a little bit about our community connection for this week. It's hashtag Lighted Blue. This is a national initiative that we're proud to be part of and to support essential workers like your grocery store workers, your delivery drivers, city, county workers that need to be there for their services, the healthcare, first responders. So please, I want to ask all of you to light it blue or put a blue ribbon on your porch or one of the trees you have in your yard. Then I'm going to ask you all to take a stroll downtown or take a drive and look. Our downtown is turning blue. The Marathon building is turning blue. I want you to take some pictures, enjoy it safely, and post them to hashtag Lighted Blue. Now I want to end by saying if you have symptoms, call the Blanchard Valley Hospital testing at 419-423-7890. If you have a general question, call the Community Resource Line at 419-425-9999. Thank you, and stay safe.